All right, good evening, and thank you all for joining us for our Lupus Awareness Workshop. Today is Wednesday, May 21st, and we are going to get started. Today, here we're going to get started with our welcome and housekeeping, our introduction of our speakers, the workshop presentation, Q&A, raffle, and then closing and surveys. So just quick housekeeping rules. Please keep your mics on mute. This workshop is being recorded. Ask questions, but use the chat initially. We will have time throughout, once the presentations are done, to take yourselves off mute if you want to ask a question that way. But if there's something that comes to you during the presentation, feel free to use the chat. And also, we'll be dropping the survey in the chat. So this will give you a time to take the survey towards the end of the workshop to let us know how you enjoyed it. But if you do not get a chance to take the survey, we will be sending it out in a follow-up email tomorrow. So please follow us on social media to stay up to date on our current upcoming activities, a lot of health resources, information, just lots of great information. Follow us on our UCM Urban Health Initiative. We are on Facebook as well as Instagram, and we also have a YouTube page. And we also have our biweekly newsletter. These are some of the upcoming events that we have. We have one tomorrow, which is Understanding Diabetes and When to Seek Care. It's a virtual workshop. We will drop the link in the chat if you're interested in joining that one as well. Then in June, we have our Real Men Cook in-person event. Some of you may have attended that. This is something that's been going on for many years with it takes place on Father's Day. The men get out and grill and do some amazing cooking. So you can find more details about that if you follow us. Also, Wednesday, June 18th, we're going to do another virtual workshop, which will be prostate cancer awareness. So again, all of these upcoming events, you can keep up with them by following us either on social media or signing up to receive our newsletter. And it's just about us really quickly. We're the Urban Health Initiative, UChicago Medicine's Community Health Division, responsible for collaborating with community-based organizations on health-related programs, research, and services for residents on the South Side of Chicago. And some of our programming includes health and wellness programs, healthcare career fairs, sponsorship events, WVON radio show, which comes on every Saturday on AM 1690, community newsletters, which are biweekly, fitness classes, free, and volunteer activities. So let's meet our speakers for this evening. First up, we have Ms. Brianne Carroll, who is the CEO of Middleby Foundation for Lupus. In 2018, Ms. Carroll started a support group for individuals who were living with lupus, which provides them with education, advocacy services, and also fitness classes. She hosts an annual lupus walk every year in May. She just had one this past weekend, and is very great turnout. Next, we have Dr. Leah Goldberg from internal medicine. Dr. Goldberg is a resident physician in internal medicine at UChicago Medicine. She is interested in the intersection of clinical medicine and public health. Thank you, Dr. Goldberg, for being here. And we have Dr. Abby Maranga from dermatology. Dr. Maranga is a second-year dermatology resident at UChicago Medicine. Her special interests include skin of color and integrating skin health into pre-existing local health initiatives, as well as global health dermatology. Thank you, ladies, for being here. I'm going to stop my share right now. And we are going to get started with our doctor's presentation. So I'll pull that up. And again, as you all are listening to the presentation, if there are any questions, please feel free to pop them in the chat, and we'll get to them for you. Okay. Moving kind of slow, but okay. All right. So Dr. Leah and Dr. Abby, take it away.
Great, thank you so much. So I'm going to start by talking a little bit about lupus from the primary care and internal medicine perspective, and then I'll turn it over to my colleague who can talk more specifically about the skin manifestations from a dermatology perspective. So when you hear lupus, the formal name of the diagnosis is systemic lupus erythematous. So you may also see it abbreviated as SLE, and is an autoimmune disorder, meaning that it's a disorder in which cells of your own body are attacking your body. There are four subtypes of lupus. So the most common, as I said, is systemic lupus erythematous, but there's also cutaneous lupus, drug-induced lupus, and neonatal lupus. So as the names suggest, cutaneous lupus has to do with the skin. Drug-induced lupus has to do with medications that can actually cause a autoimmune reaction in the body. And neonatal lupus affects neonates or babies when they're first born. Systemic lupus erythematous is most common in women, and it's most common from ages 15 to 44. The survival rates in lupus are very excellent. In medicine, normally we talk about a 5-year survival, and that 5-year survival is greater than 95%. So while lupus is a serious diagnosis, it means that when people are diagnosed with lupus, their chance of living past 5 years is over 95%. So very good survival. That being said, the diagnosis itself is a serious diagnosis because, as you may already know, or hopefully will know by the end of our discussion, lupus can affect many different parts of your body and many critical organ systems. As a result, people who have lupus often suffer from many different symptoms that reflect the organ system that their disease is involved with or attacking. And many people who are diagnosed with lupus also have at the same time another autoimmune disorder. So autoimmune disorders can actually happen at the same time as lupus and cause a person to have even more symptoms. Can we go to the next slide, please? So this is just a reminder of how many people are living with lupus in the United States, and this is a rough estimate from recent data. So there's quite a number of people, most of them were female at birth, who are living with lupus now. You can go to the next slide. Okay. So here I wanted to go through some of the most common symptoms that people who have lupus can have. And as you'll see in the graphic on the right side of the screen, many of the symptoms are reflective of what organ is involved. So there are some generalized symptoms within the whole body, like feeling very tired or fatigued, having a lot of joint and muscle pain, or having fevers or weight changes. And then there are some symptoms that can be very specific to certain parts of the body. So, for example, on the skin, you can have particular rashes, which Dr. Abby will get into in more detail later. In the heart, you can have issues of the heart like endocarditis, which is when there's inflammation within the valves of the heart. You can have atherosclerosis, where there's buildup of plaque in the blood vessels. And you can have inflammation around the casing that the heart is in. Similarly, for your lungs, you can have inflammation or pleuritis and pneumonitis, which is inflammation of different parts of the lung. You can have blood clots and you can have bleeding. In the kidneys, you can experience blood in the urine. And then in the blood, you can experience anemia, so low hemoglobin count, and you can experience high blood pressure, all as a result of how the lupus is affecting any given patient. Within the mouth and nose, those are common sites of mucous membrane involvement. So you can have ulcers that form either in the mouth, the nose, or both. So as you can see, a lot of symptoms that can cause a real impact on someone's quality of life, and why it's very necessary to have accurate diagnoses and get treated as quickly as possible. You can go to the next slide. So, I wanted to talk a little bit about when you should see your primary care doctor. I work as a primary care doctor at UChicago, and so my experience with lupus is either on the inpatient side, where I'm treating people in the hospital, or in clinic, where I meet with patients who may already know they have lupus or may be concerned that they have a diagnosis of lupus. So, if you have a family history of lupus or SLE, or if you have a family history of other autoimmune conditions, it's always a good idea to get in to see your primary care doctor, even if you're not having symptoms at the moment, because we can kind of help identify what risk factors may be in place, and you can establish a communication line with a physician in case you get to a point where you are having symptoms and you want to be evaluated more closely. Certainly, if you have symptoms that are consistent with lupus, it's important to see a doctor. As you could tell from the previous slide, there are many different symptoms that can be lupus that also can be totally unrelated. Constellation of symptoms that you're concerned about, it's always important to be seen by a healthcare professional so that we can make sure that there's nothing that we need to intervene on or that we should be testing for. If you know that you have a diagnosis of lupus, if you are planning to get pregnant, it's absolutely necessary to either consult with your primary care doctor, or if you already have a rheumatologist, which is a doctor that specializes in certain autoimmune conditions such as lupus, it's very important that you get connected with them. And that's because pregnancy brings on its whole own other set of changes to the body. And when people who have lupus get pregnant, they can often have worsening lupus flares, or they may need an adjustment of their medications. And so, if that pertains to you, it would be a great idea to see your primary care doctor or your rheumatologist. So, what can you expect when you go to a doctor's appointment with a primary care doctor and you are concerned you have lupus and you want to get what we do is we talk to you a lot about what symptoms you're experiencing, what your personal health history is, and what your family health history is. Because as I mentioned earlier, if lupus is something that runs in your family, that can give us a clue as to how likely it is that your symptoms may be because you have lupus. Things that we would order would be a lot of blood work. So we start by looking at a complete blood count. We look at kidney function and the chemistry of your blood. And then we may also send off for certain inflammatory markers that can give us a clue as to whether or not lupus may be the appropriate diagnosis for you. We also test the urine because, as you recall, I mentioned that lupus can affect the kidneys. So in addition to doing a blood test that looks at your kidney function, we can also test your urine. And then we'll ask you a lot of questions about different organ systems. So, what I mean by that is we may ask you a lot of questions about things that pertain to your heart health, to your lungs, to your joints, to any neurological symptoms, so that we can get a sense of whether the nerves of your body are involved, or maybe if you have a different diagnosis that doesn't pertain to lupus. And then we would also ask you a lot about your skin and maybe even refer you to dermatology, as Dr. Abby will talk a little bit more about later. Whenever you have a lot of symptoms that are concerning to you, or maybe don't make a lot of sense to you in terms of, gosh, why am I always tired? It's really helpful to keep what we call a symptom diary that you can actually bring into your doctor's appointment. So, what that means is that you would track your symptoms at home using either the Notes app on your phone or a pen and paper, and make a note of when you have that particular symptom. It's really helpful because, from our perspective, we're only getting to meet with you for a short amount of time, maybe 20 to 30 minutes. And so, if you already have some information about how your symptoms have been over the past few weeks, that can really give us a clue into how we can best help you and how we can best order the right tests to figure out what's going on. As a primary care doctor, if I'm very concerned based on the questions that I ask or based on the blood test results, if I'm concerned that you have lupus or another autoimmune disease, I would refer you to a rheumatologist, which, as I said earlier, is a specialized doctor who can really treat and manage the lupus. And they may do further testing and talk about what treatment options are available. Generally, when I have patients who have a diagnosis of lupus, it's a joint effort between myself and their rheumatologist, so that I can see them in between the times when they see their rheumatologist and be in communication with the rheumatologist to make sure that we're doing the best job of keeping on track with the medications and monitoring any follow-up blood work. So with that, I'm going to hand it over to Dr. Abby to talk about skin and lupus.
Fantastic. If you don't mind going to the next slide. So the skin is one of the most commonly affected organs in lupus, and it can be one of the first signs that someone actually has lupus. Now, lupus is a very kind of like a diverse condition, and it can affect all different organ systems. So not everyone that has lupus necessarily has skin symptoms, and sometimes the skin is the only place that's involved with lupus. So it's something to just keep in mind. Do you mind going to the next slide? So this rash, which is called the butterfly, or the official term, which is called a malar rash, is the most commonly associated rash in lupus. Um, it's a rash that affects like both of your cheeks, and then will also affect kind of the bridge of the nose. And it gives this kind of, that's what gives it the butterfly look. It's usually red, but particularly in patients with darker skin types, sometimes it can look more purple. Sometimes it can look like hyperpigmentation. Sometimes you'll get skin bumps that are associated with it, and sometimes not. And then sometimes it's really scaly, almost like what, eczema could look like as well. And so I was trying to, in this slide, show what it looks like in different skin tones. And as you can see, it can look very different. Next slide, please. So when you have this rash, what you usually is associated with it, and again, it varies per person. It might feel warm, you might feel a little bit of swelling. The redness tends to last a while. It can last, for a couple of hours, but it could also last days or weeks. And one of the most characteristic parts of this rash is that it gets worse with sun exposure. And then afterwards, after the rash kind of burns out, if it does burn out, sometimes you can have some post-inflammatory hyperpigmentation or skin darkening. And that's usually more common in patients with darker skin types. And so this is a different kind of rash that I bring up because oftentimes when people come to the dermatologist office, they might come with just a rash and they're like, oh, I know that this could be associated with lupus, and that's fantastic. And we really, the point of this presentation is to make you aware of all of the different ways that lupus can look like. And so we always welcome when you come to your dermatologist kind of thinking of what it could be. But there's another kind of rash that's called rosacea that can also kind of affect similar parts of the face that lupus can look like. It also can get worse in the sun, but it also tends to be triggered by things like coffee or caffeine or chocolate or alcohol, and you can have burning sensations. And so the main thing is that if you were having a rash on the face and it kind of looks like, oh, maybe there's a butterfly rash, do bring this up with your doctor. Do bring it up, and maybe they'll have you see a dermatologist, and then we can, run some tests and do some testing to see, okay, is there something going on that we need to do some further testing on, or can we treat it because the treatments are very different. So rosacea is not an autoimmune condition, but of course lupus is. Next slide. So this is a different type of lupus. It's called subacute lupus, and as you can see, it looks a little bit different. It kind of looks round. Some people will think that, oh, this kind of looks like ringworm. And it can affect the face, it can affect the arms, but it looks very different from the rash, the kind of just flat rash that you have on the face. But this is another different kind of lupus. And then this is yet another type. This type of lupus actually is commonly seen that when you see it, sometimes it's just in the skin and it doesn't affect the other organs. This type is called discoid lupus, and it presents with these kind of rashes that tend to leave behind scars. They're a little bit deeper. They're associated with burning and itching. Um, and then one classic part is that around the scar, you'll see some like kind of darker skin, and tend to see that more in darker skinned individuals. For all of these rashes, sometimes when you come to your dermatologist, they might recommend a biopsy, which is taking a small sample of the skin and sending it off to the lab to see what's going on. And that can also help differentiate a lupus rash from other rashes. So that was kind of just a broad overview, but lupus can look like a lot of different things on the skin. And so it's really important that with any of these skin findings, you are talking to your primary care physician, you are talking to your dermatologist if you already have one, that, hey, this new rash popped up, kind of like what's going on. And so that more, research can be done, more evaluation can be done to see if it's, there's something else that's driving it. Can you go to the next slide? And so, in terms of treatments, it depends on a lot of things. It depends if the lupus is just in the skin, or if it depends if you have other more systemic or other body parts that are affected. Oftentimes, even if we are seeing you in the dermatology office for the first time for a rash and it is lupus, we will, and if it's more than involving the skin, we will recommend, like Dr. Leah said, we will refer you to a rheumatologist to start some of these medications. If it's just limited to the skin, things that we do, especially since it can be worsened by the sun. The most important thing is sunscreen and sun protection. So we always start with that. And then when it is affecting the skin, oftentimes we will recommend starting steroids. So they can be topical, like creams or ointments that you would apply to the rash. And then in some cases, especially if it's involving other parts of the body, your doctor might have you on steroids that you might take by mouth or even intravenously if there are some serious consequences from the lupus. Oftentimes, because it's an autoimmune condition and it's because your immune system is kind of attacking your own body cells, will put you on medications that will try to calm down the immune system. I put an example of two of these here. There's many different kinds. Um, a common kind that I actually did not put on the slide is Plaquenil. That is a common medication that patients with lupus are started on because it has shown to be effective. And what all of the point of all of these medications is to calm down the immune system that is kind of overacting and leading to the effects of these rashes or of the effects more internally. And so your doctor might talk to you about starting some of these medications, which we are commonly used in individuals with lupus. They can be pills taken by mouth, or they can be injections that sometimes you can even either do at home or come to a clinic and get IV infusions. And of course, the treatments vary very widely per person. So it's like Dr. Leah said, a collaborative, effort between your primary care physician, your rheumatologist, your dermatologist, if they're involved, and any other, like if you have kidney involvement, you might also see a kidney doctor. And it's really a group effort to keep patients as healthy as possible. And then that is it.
So much, Dr. Abby and Dr. Leah. It's a great presentation, great information. Are there any questions? Let me see if there's anything in the chat. So nothing yet, but we'll get some towards the end. So again, for that informative presentation, we are going to pass it on to Brianne Carroll.
Hello, everyone. Can you hear me? Great.
Yes.
I hope so. Okay. Hello. Hi. So I am here today to talk about my nonprofit, the Middle B Foundation for Lupus. I want to thank Doctors Abby and Leah for providing the educational portion about lupus. Now I'll provide the resources. I do want to share my screen. So 1 second. Okay. Okay. So we are the Middle B Foundation for Lupus, and we can be found on social media at Middle B17 on Instagram, Facebook, and YouTube. I want to share a little bit about us, but let's first go over how we ended up with our name. So the Middle B Foundation for Lupus. A lot of people ask, well, where did you come up with the name? So my mother had three daughters. All of our names started with the letter B. So you have Brianne, you have Brandy, and you have Brittany. So 3 Bs. The middle B, which is Brandy, she passed away from lupus in November 2017. So that's where the name comes from, the Middle B Foundation for Lupus. We do this in her memory. We provide personalized resources for the Chicago lupus community. We also offer financial assistance, care packages, volunteer opportunities, community outreach, a free group fitness class, monthly support, an annual lupus walk, and educational information about lupus. Here's a little bit of our history. So as I mentioned before, my sister passed away in 2017. So it was in 2018 when I decided I wanted to start a support group for individuals with lupus here in Chicago. And since then, I've organized a lupus walk every year in the month of May. We just had our 8th annual lupus walk, celebrating 8 years already, that fast, at the Dan Ryan Woods on 83rd and Western. And we get support from family and friends, but now we've been getting support from new faces in the community, new people from all over. And seeing a need for more contributions within the Chicago lupus community, I officially formed a nonprofit in 2021 to advocate for the people I love and to help spread awareness about lupus disease. I am the president and the founder of this nonprofit. Our mission and vision. We envision a life with ease for all people affected by lupus through support, education, and advocacy services. It is our hope to end lupus forever. Again, as I mentioned before, we are doing this in memory of Brandy Carroll, aka Middle B. Here's just a couple of pictures from our past lupus walks. As you can see, our signature colors are purple and yellow gold. Here's a little bit of our impact. We do have to update this at the end of this year, but we've had an estimated 540 plus people in attendance at our annual lupus walk since 2018. We've distributed 40 care packages since 2021, and we've distributed 16 lupus relief grants since 2021. We also have fitness classes. We offer an annual free fitness class in the month of October to the Chicago lupus community. We rent out a gym and we have cycling. And if you're not able to cycle, you can also utilize the rest of the gym. We also offer yoga and meditation. We were doing yoga and meditation on Zoom, but we now offer it in person at the Blue Island Waterfalls. We will have, we had an in-person event last year in July. Our next one will also be this year in July, July 27th to be exact. I will send out newsletters and invitations. We also have this jump rope initiative. It's called Let's Jump on Lupus, where we do a challenge. It's a 5-day challenge that we're going to have in June. And I'll also send out reminders and invitations for that. It's going to start June 9th on a Monday and end Friday, June 13th, where each day you and whoever else you want to participate, you're gonna jump. Just jump, and keep in mind that we're jumping on Lupus. You can do as many jumps as you like, however many you're comfortable with, but make sure you take pictures or do a video and tag us on social media. We also have another challenge. It's an anti-inflammatory challenge that one of our other board members will be hosting as well in June, and I'll send out reminders for that. Here's some of our information here, our mailing address, the phone number, direct number. You can contact us at 312-779-9247, and our email, info@themiddlebfoundation.org. I want to share with you all a video, a YouTube video of one of our past lupus walks. It may be a little loud, so you can adjust your volume on the screen when you can. Let's get to it. This was in 2022. My volume's still up. Okay. It's a little loud.
Great, we can't hear it.
Okay. Let me get out of here. Okay. Let me stop sharing my screen.
All right. Thank you so much for that, Brianne. Unfortunately, we couldn't hear the sound, but maybe if you share it with
This whole
me
time?
this whole time. No, but that's okay. If you can share it with me, then maybe I can send it out in the follow-up email to the participants that are on here who may want to watch it. So we'll figure it out. It's okay. It's okay. But it was a great video. I appreciate
Oh,
you sharing that. Thank you so much. So
all
now,
right.
yeah, go ahead. I'm sorry.
Okay. One last thing. I see I have a couple more minutes. Um, I can also put the link to the video in the chat. I really thought you all could hear it. Okay.
That's
But I want to let you all know that we are having a fund drive. We are collecting gently used household items like cups, spoons, forks, plates, coats, shoes, clothes, blankets, pillows, whatever you have in your home that's not furniture or appliances, we are accepting. And we partnered with a thrift store who will take the items from us and they will provide us with a check and they will pay us by the pound for those items. And 100% of the proceeds will go towards our lupus relief grant. It's a grant that we have that supports lupus patients who are struggling financially right now. So we raise money by collecting these gently household goods. So if you would like to donate, please give me a call or send me an email and we can take it from there. And I can let you know where to drop off the items. And that is all. Thanks.
Wow. Thank you so much. That sounds amazing. So definitely share that information with me and I'll pass it on for sure. But thank you for that. Thank you for your presentation. So now we are going to open up the floor to anyone who may have questions. Now is your time we do have a couple questions in the chat that we're going to read as well. So if there's anyone who has a question, go ahead. If not, I can get started with reading a couple of the chat questions. Okay, so yeah, I'll get started then. So there was a question about someone, good evening, great presentation. My name is Esima. I don't want to mess up your last name. A third-year medical student at the Ohio State University College of Medicine. I have a question on how you navigate medication adherence for young women, especially if they are planning to be pregnant or of childbearing ages. Also, how can you differentiate between a lupus flare versus infection, especially in immunocompromised patients? Thank you. Great question.
I can start on that, and then if Dr. Abby wants to add anything, she can do that. So that's both really excellent questions. Navigating medication adherence for people who are wanting to become pregnant is extremely important because some medications can have effects on the unborn fetus. And also, as I mentioned earlier, flares can worsen during pregnancy. So that is definitely a time where, as a primary care physician, I'd be working very closely with not only the rheumatologist, but also the pharmacist and the patient to engage in shared decision making, to find a regimen that is safe for baby, but also keeps the lupus and any flare symptoms manageable for mom. So that answer is a little bit more nuanced and patient dependent, and one that really requires a lot of multidisciplinary engagement. In terms of differentiating between a lupus flare and infection, you bring up a great point that for many of these patients, they're on medications that, as Dr. Abby mentioned, can suppress the immune system or cause them to be immunocompromised. And When that occurs, the body has a harder time fighting off infections that people with a immunocompetent or full robust immune system may not have any trouble clearing on their own without even knowing that they were sick. A lupus flare tends to be a worsening of symptoms that that patient normally has. So, for example, if they have muscle and joint aches, they may have really debilitating muscle and joint pain, which would be easier to distinguish from an immunocompromising infection that might have fever, a productive cough, other common infectious symptoms. Um, I'll let Dr. Abby kind of give her perspective on how the skin symptoms can be more difficult to tease apart. But I would say for anyone who's on a medication that makes them immunocompromised, if they have symptoms such as a fever, even if that is a symptom that they normally have with lupus, I would want them to get checked out either in the office or in the emergency room if necessary, because that can be life-threatening in patients who are immunocompromised and something that I would not want to chalk up to just a flare symptom.
Yeah, fully agree. For both of those questions for the pregnancy and childbearing ages, all of medicine should really be personalized to each individual situation. And so we certainly have people in that category. And some of the classic medication that you use for lupus can be also done while, trying to get pregnant or while pregnant. And then in terms of differentiating between a lupus flare and infection, they can present quite differently on the skin. They tend to have a different look. But if there's any concern, ever concern from infection, you are being fully worked up for an infection, especially since some of these medications can lower your immune system.
Thank you. So this is another question. Hi, for those that do not have insurance and are experiencing symptoms of autoimmune condition, what are some holistic approaches that you guys may suggest?
This question, I think sometimes in terms of more holistic approaches, it varies very widely by different individuals. So some people will try to have a more kind of like try to change their diet, and they find that when they change their diet it kind of improves symptoms, or certain things that they eat affects their symptoms more. Oftentimes, especially stress is a common associator with lupus flares, and so we often kind of, when it comes to any autoimmune condition, keeping your body the healthiest that it can be, eating whole foods, eating a balanced diet, limiting, extra added sugars and fats is always encouraged for kind of any condition. And then specifically when it comes to lupus, things like managing stress is very important, as well as sun protection, since the sun can kind of make your symptoms, especially skin symptoms, worse. And so very diligent sunscreen, wearing sun protective clothing, hats, long sleeves, and things like that can all, be other ways to try to keep yourself as healthy as possible with an autoimmune condition.
Great, thank you for that. There's a comment from Betty who says she has a lupus organization, Living Life with Lupus Support Group. We have served the Chicago and South suburbs for over 25 years. We have the largest support group in Illinois, and I am the chairperson. I'm very proud of Brianne. She's doing an amazing job. I am a 30-year lupus survivor and look forward to seeing Brianne do more amazing things for lupus. Thank you for that shout out to Brianne. She is doing an amazing job. We appreciate her contributions. So we have Ms. Mims. Thanks for this very important presentation. I would like to get your opinion on the questions. Are you aware of information about skin issues, especially dark spots over the body, that may be caused by the long-term use of Plaquenil?
Yes, we are.
Right,
hmm
doctors?
So as a dermatologist, we are very aware. It's a rare side effect, but of course, it's a side effect that we discuss with everyone. of the potential for skin darkening in specific areas, but it is quite rare. We have a lot of patients who are on Plaquenil, not just for lupus, but for many different conditions. And I think that out of kind of like the hundreds that I've seen at this point, one patient came in with the skin darkening, so it is quite rare. But it is a potential side effect. So I appreciate you bringing it up. And I also saw someone respond to that about having to get their eyes checked while on the Plaquenil, which is another thing that we do. We usually add the check your eyes and make sure that they're healthy. Plaquenil at very high doses that we usually don't prescribe in individuals can carry a long term of, harming the damaging the retina, but we usually don't prescribe it at doses that it can cause that. And if you get it checked with an eye doctor, it can, if it starts to happen, it can get caused early and not lead to permanent damage. So at least when I'm talking to my patients about the medication, we bring these up because we're aware that those are side effects, and of course, we're always monitoring for it. However, it's pretty rare, and especially if the medication is helping your lupus symptoms, it's something that we would monitor, but like proceed with treatment.
Thank you. Next question. Can people with alopecia areata experience symptoms related to lupus? I experienced a lot of symptoms related to lupus, but I've only been told that I have alopecia areata and I've been dismissed for lupus. I have learned that people in the autoimmune disease spectrum have related symptoms. Thank you for
I'm
that question, Rihanna.
I'm happy to take that too, because we also deal with hair loss as well. Alopecia areata is another type of autoimmune condition. So it is your immune system attacking, parts of your body, but namely it's attacking your hair follicles, leading to the hair loss. So it is true that a lot of patients who have autoimmune conditions kind of experience some similar things because it's caused by similar, your body reacting to your own cells when it shouldn't. And so it is possible that you are either, you're experiencing kind of like symptoms that are connected to autoimmune conditions, but if you are still experiencing like autoimmune type symptoms, it's really important to be evaluated for other autoimmune diseases because there's many things that we didn't talk about today. We didn't talk about things like rheumatoid arthritis. We didn't talk about Sjogren's disease, dermatomyositis, all of these things that are also autoimmune and can be associated with alopecia areata. So if it's not lupus, if it could be something else. Um, so it is possible. Long story short, it's possible, and it might not be lupus, but it could be something else.
All right, thank you for that. And we had a piggyback question regarding how do you approach seronegative lupus, which is something we didn't talk about either, but that's one of the questions.
Yeah, I can go ahead with this one. So seronegative refers to the fact that one of the blood tests that I mentioned earlier in the PowerPoint is negative. So even though the patient does have lupus, the most common blood test that we do to establish that diagnosis, for whatever reason, may not come back as positive. And so in that case, it actually is pretty challenging to get to the right diagnosis, which to Dr. Abby's point, it's important that if you have symptoms of an autoimmune disease and maybe you test negative for lupus, it's still important to consider alternate diagnoses, as she mentioned, and then also for your doctor to be able to explain to you why they don't think that it's seronegative lupus, because that is a very real diagnosis and something where it can be easy to think initially that maybe the patient doesn't have lupus. That being said, as we mentioned earlier in the presentation, lupus itself comes with a variety of clinical symptoms and historical features, whether that's personal history or family history. And so if a patient has multiple symptoms that are consistent with autoimmune pathology, and they have either a personal history that's concerning, such as in addition to their current symptoms, something like recurrent pregnancy loss, which can happen in autoimmune conditions, or if they have a strong family history of either lupus or another autoimmune condition. Even if their blood tests are negative, I would still likely refer that patient to rheumatology for more advanced workup, and collaborate with them to ensure that we don't miss a seronegative lupus diagnosis. So I hope that answers the question and gives everyone a sense of what seronegative lupus means and how to best advocate for yourself if you're concerned about your symptoms.
Thank you so much. I'm going to pass it over to my teammate, Afia. She's going to ask the next question. It was what to do for rashes on the face. Well, you can go ahead. Well, I think you guys already touched on this topic, but question was asked what to do for rashes on the face and dealing with hair loss due to lupus.
Yeah, so oftentimes for rashes that are related to lupus, what we would do is recommend topical steroids to stop that inflammation in the skin and calm it down. And then it's not necessarily something that you need to take forever, but oftentimes you'll need to take it when the rash is active, and then kind of when it like burns out, then you can stop and then kind of manage, especially with like sun protection, because the sun can make the rashes worse. In terms of hair loss due to lupus, there's different kind of ways that that can show up. Some people with, having an autoimmune flare, having increased stress, they can have general shedding. That hair is expected to grow back and hopefully gets better when the stress is under control. Other people will have things like alopecia areata, which is a different condition, but it's associated with lupus and has hair loss that we actually also treat with topical steroids too. And sometimes we'll even do steroid injections to try to, the point of the steroid is to calm down the inflammation. All of this is to calm down the inflammation. And so those spots we can inject it or we can use a topical steroid to calm it down. And then other people will also have that scarring lupus that I was talking about. Discoid lupus, oftentimes it comes on the scalp. And again, we're going to use steroids. We're going to use steroids to try and calm it down. If it is not responding to the topical steroids, then sometimes we can start pills by mouth or injections that you can take to try to calm things down. But the main thing to do is that we would reach for is for the steroids. Again, it's really important that you're working either with your primary care physician, who will likely refer you to a dermatologist, because then we can determine, like, is this rash because of the lupus? Do we need to treat it as lupus? And do we need to biopsy it to do, anything further? And the hair loss as well. Like, is this hair loss from the lupus? In that case, we have to treat the underlying lupus. But if there's something else going on, then we treat that. So the long story short, it's mostly steroids and protecting yourself from the sun.
Okay, thank you. So we have another question by Rayona, and they asking, what have you noticed are the lifestyle of people before being diagnosed with lupus? I know that a lot of people don't know exactly where the autoimmune conditions stem from.
I will say that I don't think that I've necessarily seen enough people before they were diagnosed with lupus and then followed them through their lupus diagnosis to really be able to pinpoint a specific trend. But I will say that in general, trying to move towards a Mediterranean diet is something that I recommend for my primary care patients. And that's because, as a lot of us, or maybe all of us, are aware, the American diet, and specifically fast, convenient food options, while very accessible from a cost perspective, which is an important component, tend to be highly to super processed foods that can be very inflammatory within our bodies and can lead to a lot of deleterious effects for our cardiovascular health. So while I can't say that I've necessarily seen that as a specific component for people before they were diagnosed with lupus, I would say that that's kind of a general trend that I've noticed is that people who move towards more of a Mediterranean diet, limiting their salt, limiting their processed foods, focusing on healthy fats like salmon and nuts, tend to have uh, better results than folks who are eating something like McDonald's for breakfast, lunch, and dinner. Obviously, those are two ends of a spectrum, and it's not always cost accessible to be able to have salmon for dinner, for example. But I do think that baby steps away from processed foods and towards more whole grains and whole foods in general is what I recommend for folks.
Okay, thank you. And then another question is from Harloni Christian. Are you able to determine if your skin problem is related to your medication?
Yes, it is possible to see if the starting a medication caused a particular rash, but it's one that would require a visit with your dermatologist. It would require a very detailed history about like when you started the medication, when the rash started, and then it would depend on what the rash looked like because some, medication related rashes can look very classic. And then in some cases, it might even require a biopsy, but there are ways to find out if a rash is related to a medication that you're taking.
Okay, thank you. I think somebody else asked, where do spots normally be on the skin for this condition? I know you guys kind of just went over that. So this last question is for Jennifer Gordon. What is the difference between being DX with lupus versus undifferentiated connective tissue disease? And can lupus become UCTD as you age? I was DX with lupus in my 30s, but I just moved here and my new nephrologist said labs no longer support that and is calling it undifferentiated connective tissue disease. It's kind of confusing me.
I will be honest, I am not a rheumatologist and I can't answer this question. I'm going to let Dr. Abby weigh in if she's able to, but from my perspective as a primary care physician, if my patient was confused by something that their rheumatologist was recommending, I would recommend that either I reach out to the rheumatologist to get some clarification or to schedule another appointment. I'm sorry if that's not the most helpful, but it seems specific to your situation, and I just don't feel qualified to answer it.
I'm happy to comment on it. So the way that these conditions get diagnosed, it's about the symptoms that you're experiencing. But we've kind of like talked about, and Dr. Lee had like pointed out, like they can be very general. It could be fatigue, it could be mouth sores, it could be all sorts of different things. So then what we found is that certain labs that are positive are strongly associated with different types of autoimmune diseases. So oftentimes it's a combination of what symptoms you're experiencing and what labs you have. The issue is that the labs are not always specific. So there are certain labs that are very strongly associated with lupus. There are certain labs that are less strongly associated with lupus and associated with other autoimmune conditions. And the thing is, these labs can change over time. And so I like to think of autoimmune conditions as kind of like on a spectrum where if you have one, like I said, if you have lupus, like having something like alopecia areata could be common. But it does increase your risk of having like other autoimmune conditions. And so what your rheumatologist might have seen is that maybe the lupus labs, while they could have been positive at one point, maybe they're not as strongly positive, but some other labs have popped up. And so undifferentiated connective tissue disease is kind of like a catch-all term for different autoimmune conditions. And so it's not necessarily that, oh, now you have something else. It could just be kind of how, everybody's body is different, how it's kind of changed over time. And so, again, we're not the experts. We're kind of just familiar with this terminology and like different labs that, are more strongly associated with different things. I would definitely ask your rheumatologist kind of like, hey, can you like walk me through, do I still have it? Is this still lupus? Is this now something else? Has one thing become something else? But just kind of for context, there are different labs that we check that can be positive for different conditions. And sometimes over time, your lab numbers, especially if you've treated it, actually can correlate with disease activity. So perhaps one thing got better, but you still have an autoimmune condition or tendency to have autoimmune conditions. So something else has popped up, but I can't say exactly without knowing your exact history and everything. So I would recommend that you speak with your rheumatologist, but it is not an uncommon thing, not an uncommon thing to see.
Thank you all so much. And thank you everyone for the questions. Really quickly, question for you, Brianne. Are you accepting new members, participants to your Middle B organization? See that you put
Yeah.
your I see that you put the organization's website in the link, which I will also include in our follow-up, but I'll let you answer.
Yes, we are always looking for new members to join our support group. One of the benefits of being an active support group member, you are eligible for our lupus relief grant if you ever feel like you're struggling financially, whether it be need help paying for bills, paying for medication, transportation. Being an active support group member will increase your chances, your eligibility to get that, to receive the grant for sure. Yes. So we are accepting new people to come on in.
All right. Thank you so much. And again, just thanking everyone for their amazing questions and thanking our panelists for this wonderfully educative webinar. This was amazing. Thank you so much. Before you guys sign off, I definitely wanted to pull up to share again upcoming events, and also we're going to do our live raffle, tongue twisted. So give me 1 second. I'm going to pull that up. And again, thank you all so much. This has been amazing. Um, and for those who did not get a chance to do the survey that Afia put in the chat, no worries, because I'll send it out. When I send up the follow-up, I will definitely share it. So no worries. Don't feel like, oh my God, I have to hurry up to try to, figure this out and fill this out at the moment, because you don't. You have time.
Oh,
So
okay. Can
yes,
I speak? Can I speak?
yes, ma'am.
Yeah, my name is Joanne Preston, and I just joined. I am so sorry I didn't catch this from the beginning, but I would like to join the group, and I'm listening on my phone right now. So
Mhm.
I did put my email into the registration. I don't know if someone can follow up with me to give me the name, date, and the time with the support group.
Okay, not a problem at all. I will definitely I'll share it with you with our follow-up. It'll have all of the information regarding what our presenters their contact information, as well as Brianne's organization's information. So that'll be shared with you so that you can uh, reach out with any questions for her, as well as join. So let me just pull up our raffle. Let's get started with that, because I'm having some, of course, technical difficulties on my end. But again, thank you all. Thank you, Ms. Preston, for joining. I know that you said that you joined a little bit late, but we appreciate you joining. So
Thank you so much.
not a problem. Okay, so oh, I don't know, wait, you all can't see the screen, can you? Okay, let me try this one more time. Okay. Here we go. Okay, coming up slowly. Okay, here we go. All right. So can everyone see their names? Everyone who's still up on the call, can you see your name on the wheel? Okay, I'm gonna spin now. Okay, we have Harlany. Are you still on? Harlany? If you're on, please unmute. If not, we gotta move on
Yes,
to the
I'm
next.
on. I'm on.
You're on. Very good.
Yes.
Thank you so much. So you are our winner tonight. Thank you so much. And I will reach out to you to get your email and we'll send out your gift. So thank you again. While I'm trying to pull this up, any other questions, comments for our panelists? You guys have any closing remarks? I am pulling this up. Anything to close us out for the evening? No.
Thanks for all of you. Thank you. Thank you all for joining us. It is
Oh, Miss Wilson, hold on one second.
Miss Loretta.
Yeah, I was saying that I didn't see my name. That's what I was telling you.
Miss Walton, can you mute yourself, please?
I didn't see my name on the wheel. I was trying to say.
I thought
Okay.
it was positive. I put you up there, Miss.
That's what I was trying to say. I'm sorry.
Okay, no
Okay.
worries.
But maybe it was there, but I didn't see it.
Yes, ma'am. Well, yeah, you're on there for sure because you are always one of our faithful
You know
attendants.
that, don't you?
Yes, ma'am. Yes, ma'am.
Yeah,
You,
well, I'm on my phone this time, so that might be why I couldn't see it, you know.
okay, no worries, but you were on there. I'll make sure
Okay,
that,
thank you.
okay. So I'm gonna pull up our last
Okay.
last bit of the presentation, and then we're gonna close out. And again, I just want to thank you all for being patient with us and thank you all for joining this evening. I hope that you all really got some great takeaway tonight. Um, our experts did an amazing job. Oh my God, it's gone again. Okay, so again, what it was showing, what I was trying to show you again was just, oh, here we go. Just our upcoming events. Afia did drop in the chat the information about our workshop tomorrow that is going to be hosted by our community champion, and it's about diabetes. And then we'll also have the other upcoming events. So please, again, if you can, just follow us and sign up for our newsletters so that you can keep up to date on all of our upcoming events so that you'll know what's going on and how to keep up with us. So we already did our raffle wheel. And just follow us social media at UCM Urban Health Initiative, Facebook, Instagram, and also a YouTube page. And here's our contact information. If you'd like for us to host an event for you, please contact us. And thank you again so much. So we look forward to you all's continued support with these amazing.
I didn't get that information. How can I get that information? It went away too fast.
Okay, I'm going to send it to you in a follow-up email. Everybody that's on this call will receive a follow-up email that'll have all of our contact information, our panelists information. So you'll get it. I got you. Okay. All righty. So again, thank you all, everybody. Have a great rest of your evening. Take care. We look forward to seeing you again soon. Thank you.
Okay.
Wonderful
Thank
panelists.
you. Have
All
the
right.
same.
Bye
Bye now.
bye. Bye bye.